What to do about puffy, droopy lids. I was born with naturally puffy lids that have always bothered me. And now that I'm in my mid 40s, 45, the puffy area has drooped and makes me look tired. From looking at my photos, what can I do to resolve this issue that is driving me crazy? Please give me advice.
Thank you for your question. You've described your personal history of always having puffy eyes or puffy eyelids, and that they've drooped even further. And you submitted these photos, which are very helpful for us to understand what your situation is. First of all, I'd like to mention that I wrote a book called The Fine Art of Looking Younger. And I described that facial aging is basically two processes. One is volume loss, which means bone, muscle, fat loss. And the other is skin elasticity causing descent. So what you're describing with drooping in your upper eyelids, for people who are used to having very puffy eyes, very often what happens is this area becomes deflated. Now by deflation, particularly you lose fat and the skin elasticity changes. So what some of my colleagues tried many years ago, and still some are doing this, is they try to restore the volume in the area where volume was lost. Now, in principle that sounds logical, but in the upper eyelid area, if you were to take fat and place it in that area, unfortunately the skin elasticity doesn't tend to hold it very well, and you may deal with a lot of swelling and some potential irregularities. So I believe very much, and this is from my personal philosophy and experience, in practical solutions that do not disrupt a person's lifestyle too much. So what I recommend for someone like yourself is an upper eyelid blepharoplasty. Now, an upper eyelid blepharoplasty, by definition, is the strategic or artistic removal of extra skin and creating this shape of the eyelid crease and platform so that your eyes look more open. So this is the art, and this is why we can't, quote, commoditize a procedure like cosmetic surgery such that it's repeated the same exact way, because 10 different surgeons will do it 10 different ways. So essentially my approach to you would be to create a crease that would be consistent with your natural ethnic appearance and what you've always had, remove some of that extra skin, and reveal the true natural shape of your eyes. So that being said, I would recommend that you do some research, interview some cosmetic surgeons who have a lot of experience with cosmetic eyelid surgery, and take a look at before and after photos to get a sense of the unique style that each surgeon brings. In addition, you should also be comfortable with the type of sedation or anesthesia that is done for you, so that once you find a surgeon that you connect with and that you feel you're both on the same wavelength, move forward and have the upper eyelid blepharoplasty. So I hope that was helpful, and thank you for your question.